Tonight's Eyewitness News Health Watch. When gun violence doesn't end in death, victims are often left with life-threatening and painful injuries. Health Watch reporter Kelly Lynn is here to explain how a local doctor is helping patients recover from gunshot wounds. Kelly?
Sally, every year in the U.S., about 75,000 people are injured by gunfire. In many cases, the damage is devastating. But tonight we meet a young man who was shot in the face, and after just 5 weeks, he's almost fully recovered. These images show the damage one bullet did to 17-year-old Nick Young's face. His lower jaw is ripped apart, his bones shattered.
I was wondering if I was going to choke in my own blood.
Nick won't say how he was shot or by whom. His reconstructive surgeon, Dr. Alexander Pazoki of the University of Maryland Dental School, explains the small caliber weapon that caused the accidental injury left doctors with the challenging task of rebuilding Nick's jaw.
Right now he has multiple plates and screws and wire that are used to hold all these pieces of bone together. This is the arch bar, again wire across, and these are the screws that are used to establish his bite.
After 3.5 hours of reconstructive surgery and several weeks of healing, Nick looks like nothing ever happened. He's eating and speaking well, and the incision scar under his chin is barely detectable.
I look basically the same way as I did before, despite the scratch underneath of my jaw.
We're able to basically restore his form, function, and send him back to his normal routine. So that's what I consider an ideal situation.
A situation that gives Nick another chance at life, a life he almost lost. And one of the more surprising things about Nick's case is that doctors were able to preserve all of his teeth, Sally.
Wow. Thanks, Kelly. With injuries like Nick's, one of the biggest concerns for doctors is infection. Patients are given antibiotics during surgery and take them for about a week after they go home from the hospital.